Hi, I'm Vasundhara. I welcome all of you to this brand new episode of Nav Durga series. What is Nav Durga series? 9 women related challenges we are discussing with 9 powerful women. Explore and find out probable solutions and the way forward. Thank you so much for all the love and support that you have given for our earlier episodes. About today's topic, today's woman is very, very confident and competent as far as her professional life is concerned. She's out there with men in that race. But somehow, motherhood has taken backseat. Something that comes naturally to her. She's a creator and nurturer. But there is a lot of anxiety, there is a lot of scare around this process now. In fact, bearing a child and being a parent thereafter has been taken as a 20-year project, which is surely not ready for. On the other side, problems like PCOD or irregular periods or many such problems are on rise. Science is on our side. Food is no issue. Then where things are going wrong? Let's find out and explore with our Durga today. Our Durga today is Dr. Shradha Upasani, a very, very reputed gynecologist, almost 5 decades of experience, and she has delivered maybe more than 50,000 babies to happy moms. Isn't it wonderful? She must have groomed and mentored more than 100 gynecologists under her wings. She's been president at IMA Mulund and she is chairman for many conferences. Let's talk to this very, very reputed gynecologist from USSH, Dr. Shradha Upasani Adurga today. For accepting my invite to be on this Navadurga series. We are really humbled and elated for your gesture.
My pleasure.
Thank you so much, ma'am. The very, very first question, in extension of my introduction, woman is out there, she is well educated, she is well qualified, she wants to focus on her career, and that's good part of it. But by the time she thinks of marriage, if at all she thinks of marriage, it is early 30s or maybe late 20s. So is that the primary reason that women are scared of, or conceiving becomes an issue? As a doctor, what would you say?
See, in my earlier practice, I always used to see all the primies. Primies means those who deliver first time. Their age used to be around 20, maximum up to 25. But now, every woman wants to study very well, focus on her career, and then the next thing is to have a baby. Of course, marriage is very, very difficult. Sometimes you can have babies without marriage also, but still it is not all that common in our country, though there are very few incidences. So the age of the marriage has gone up like anything. It has come up to 30, maybe 35
Five
also
also.
sometimes if the woman is very much focused in her career. And there are many, many complications if the woman is if the woman becomes pregnant first time after 35 or around 35. Like the elderly primary has a high blood pressure. First thing is first trimester and second trimester. Abortions are very common. Diabetes is increasing as the age increases, and all these have effect on the mother as well as the baby. The baby gets very less blood supply because of the hypertension, diabetes, and the growth of the babies is restricted. We call it as IUGR babies. And their growth is definitely, supposing the average healthy baby is around 2.75 to 3 kilo, these babies are around 2 kilo. They are getting very, very less nutrition in the uterus. And that is why when they to come up to the healthy babies, they take at least 6 months to 1 year in the competition. So naturally, the growth of the baby is less, the diseases in the babies are more, mental retardation is more, Down syndrome is more as the baby mother's age increases.
So ideally, as a doctor you would see or suggest, what would be the right age then to have the first baby? Is around 25 to 30?
25 to 30.
25 to 30.
Mm-hmm.
But fine, that's an ideal thing to do. But understanding that there is a competition out there, women today may say I'm equally competent to men, and by the time they reach a particular professional height, or the ladder of that particular professional success they want to achieve before even, as you said, getting married, let's say that it will be more than 30. So what all other things that they can consider or take care of? I mean, as a layman, I heard about freezing eggs, or are they really advisable, or what is it? Just tell us.
Actually, first I want to make one more point that today the parents have only one child, maybe maximum two. And if it is a single baby girl, the parents pamper the girls very much. So whatever the girl says, they agree.
Correct.
If the girl says, I want to study up to this, okay, go ahead. But earlier generation, it wasn't like that because there were two, three, maybe four children for each parent, and they wanted that every girl should get settled before they become old. And that is why whatever the girl says, they were not very keen on listening to her. And that is why that was one more point that all the girls were getting married around 25.
Absolutely.
But now the girls are only the one single child of the parents, and that makes a lot of difference. And that is why the girls can get education whatever they want. Earlier it was not like that. They had to get adjusted. But now, because only being one child and all the parents are affording, they can study whatever up to the level, whatever they want. And once they study, they say, we have studied so much, I have to give justice to that.
Correct.
So the marriage is always prolonged and the career goes ahead.
Correct.
And whatever happens, you have to have Suvarna Madhya.
Correct.
So you have to have education, career. At the same time, you are a woman. So you have the duty of reproduction and you have to do that.
Reproduction is, yes, your primary duty.
Mhm.
At the same time, the child, which is new generation, his health is also mother's
Very important.
concern. So let's look at other aspects of millennial women or girls. Are they really taking right care of their health? Because are they aware that they are the ones who are going to create the new generation? What's your experience?
Yeah, they are aware. Because sometimes once they become pregnant, immediately they ask now what care I should take. Even the husband asks both the couple. Means most of the time earlier what used to happen, the mother used to come with the girl when they are pregnant. Now husband and wife come. But both of them now once it happens, they want to take care. The one more point I wanted is, as such, both of them are comparatively elderly, and in the career they decide that now I want the baby. 2 years have happened, and both of us are settled, so now they want the baby. And within few months they should become pregnant. 6
It's
months.
a process. I love it.
6 months is a period. Madam, we are trying for now 3-4 months, but we are not conceiving. It's not a joke.
It's a natural process. I love it. True.
But then that is what happens,
Also, there is a lot of
Ha,
anxiety.
lot. This 4 months we have tried, madam, but we don't have. So now we want to go for IVF. You were asking me.
Correct, correct,
But
correct.
I said, see, there are some treatment before going for IVF. There are so many other minor things, basic things that we should carry. Then if we don't get response within 6 months to 1 year, then you can go ahead. No, we want now. This is our timetable.
So it's built like a project, but then yeah, so true, so true.
And money is not that much problem.
Correct, correct.
Earlier for IVF, the cost
Timeline is
comparatively,
more important.
yeah, comparatively cost was more for the
Correct, correct.
our population that
Correct,
time. Now people have money like
Money,
anything,
correct.
so they want to go for IVF very fast.
Correct, correct. Which also is not right, but if it suits their pocket,
Yeah,
then
exactly.
go as well. What I was asking is because of this, the whole emphasis on zero
Mm,
figure, and
yeah.
I want to look a certain way, and I want to have such wardrobe. So before even coming to that point of getting pregnant, what is the nutrition that they have provided to their body? Are they really ready for it?
So before becoming pregnant, they don't do any much things. Only thing, if they are drinking or smoking, that much they are aware that if they become pregnant, they should stop
Stop.
drinking and
After they
smoking.
get pregnant, they should
They
stop.
should stop.
But what about what they did it as
Pre
a fashion?
Pre-pregnancy, yeah.
Huh.
Pre-pregnancy, they don't think that.
So what are the problems they may face or they are facing?
If the smoking goes on, then the babies are very quite lightweight. Means they are premature also, and their weight is also less because the blood supply going to the mother, because there is a bronchospasm, and that is why the blood supply going to the babies is bit less.
So do you think now again we need, and there is a requirement to emphasis on this aspect that woman is special because she is a creator and nurturer of this new generation, and her taking care of the body is more important than a man taking care of his body, because if anything happens, it happens to him. But if anything happens to her, or if she doesn't treat it like a temple, uh,
Yeah,
she is going to harm the
baby.
child and the
Future
baby, the new
future
generation.
generation,
The entire generation
future
will be
generation,
like that.
definitely, yeah, yeah, yeah.
So, what do you suggest? What are the care? What is the care that they should be taking?
See, as I said, the smoking, drinking should be stopped. So many parties they attend, that also is harmful because lot of food from outside they
Yes,
eat, and that is not hygienic, not clean, and we don't know how impure it is, what is mixed in that, and all.
spoiling their
So
bodies.
that their nutrition also spoils. So they should eat whatever is made at home, mainly herself or maybe mother or mother-in-law, not by servant also. That is also better. And lots of proteins they should have. For a vegetarian mothers, in vegetarian food, the proteins are less, but still there are plenty of this thing for choices for us. Paneer is one of the thing. All the cereals and groundnuts, all dry fruits also contain. So they should choose their diet.
Right food.
All the 9 months, proteins and vitamins are very, very important.
That's
Hmm.
really insightful. And I think we all need to look into this very, very
Yeah.
consciously. Completely agree, ma'am.
But some of the mothers and of course father also, they are really very particular because they are educated. Sometimes they just write down what, and I have made this thing only
Chart.
chart that I give it to every patient. You first 3 months you should have this, the next 3 months here, and 6 to 9 months like that.
Correct.
But they really want to, but because they say we are going to have only one child and we want to take care of that
Now, let's go on completely
child.
other
Other
side,
side.
that yes, we want to take care of the child, so they get
Hmm.
overwhelmed with this idea of, oh my god, we are going to become parent, and we have WhatsApp University,
Yeah,
and we have Google Baba to
Google.
tell us what to do. What has been your experience, ma'am? We have been hearing hilarious stories
Last
and
five
jokes.
to 7 years, I'm really fed up with the patients. First thing, they Google what each and everything. Then they think, I know better than the doctor. I will ask the doctor. They go on ask, they write down on the one. This thing only they bring it on the mobile. Yeah, this way, that
I
way.
have read this.
Yeah, yeah, yeah. How do you? What is ovulation? Then we know this is ovulation. And you are saying this. So many questions they will go on questioning you that whether you know anything or not. They don't
After
earlier
50 years
whatever
of
doctor
experience,
whatever doctor used to say earlier
we
in
never
our first
question.
25, 30 years they never used to say. But last 10 years so always all the time all the couples will ask. And nowadays everybody knows everything in the Google how to do that and all. If they don't know they will ask.
But what do you suggest?
Practicing
I
has
mean,
become
is
very
it really
difficult.
becoming difficult for them also, because then they are
They
more
have
confused?
knowledge.
Because if you
Mm.
have coughing issue and you Google will lead you to cancer,
Yeah.
that you may have cancer. So, and this is something which is so, for it's a 9 month process, and
Yeah.
you're going to go through lot of hormonal issue, lot of physical changes. So if continuously they are bombarded with some wrong knowledge instead of
Yeah.
taking it from a right source, it's a huge problem. So what do
It is a
you suggest,
problem. It is
ma'am?
a problem. And I just tell them, if you want to go through the Google, then don't come here, no? Because we have our knowledge.
Delivery can't be done by Google.
And they always know half, and they will just by word they will read, and they will try to take out what is what. So it becomes difficult
I
all the
understand.
time
I
telling
understand.
them, don't do this, don't do that. Because as such, Google will not give you complete idea about anything.
Correct.
They will just give you choices, and this thing and that may happen.
Correct.
So, abhi they will say ovulation, according to our calculation through Google, the ovulation will occur on 13th day. I said it is not pakka that every woman will have ovulation on 13th or 14th day, depending upon her menstrual cycle, that they will vary. So we have to do sonography to find out how the size is increasing, whether the ovulation has occurred or not occurred. Just by that chart, you will
Chart.
not get that. But you have to convince and make them understand.
That it has become mathematics for
Ah,
them, which is actually
yeah,
a very
exactly. It is a
natural.
science and arts mixed. It is, it is
So
not
true.
only science.
So
It is
true.
not only arts.
So
So,
true.
mm,
Now, my last question. So, knowing that, and it's now come to all the, with all the data that is there available, fertility is, hampered and percentage is really decreasing.
decreasing.
So, what is it that we can expect in future, or what is it that we can, what can help this?
See, if you go through the Western countries, what we are facing, they had faced it earlier, some 20, 30 years back. So what has happened is now at this stage, they are working or population has decreased a lot. Their population above 60 has
Yes.
gone up, and before 20 also has gone down. So working population is very less.
Less.
Whereas in India it is still more.
It's still young
Yeah, because
nation.
still couples are more who want one or two. Because there are more couples. They
Yes.
have less couples only,
Also,
and that is when they want only one or two. So in after 20 years, maybe we will
face
go
the same
same
problem.
problem. And as the mother's age is increasing, maybe the quality of population also may go down. So we have to take care of
Correct.
that we should enforce the girls, that of course your career is important, but you have the responsibility of the future
Next healthy
population.
generation
Yeah,
is
so you
our
have to
responsibility.
groom yourself.
So true.
You have to means you have to think of both the things,
Correct.
and accordingly, at least below 35, you should become pregnant.
You can't ignore it
Yeah,
completely.
completely.
It's really been wonderful talking to you, ma'am. Just last question, or may I request you to give message out there to all our Durgas who are maybe now looking at their motherhood, or maybe very, very young and may think of becoming a mother tomorrow. I think they all need to hear your message.
See, there is lot of difference between the girl and the boy, or maybe man and woman. The man has only career to do, only competition, and whatever he does for earning money, for earning name is okay. But the ladies are very different. Though we are competing with the men at this stage, we have very much big responsibility of future generation, and if we want that our future generation should become nice and intelligent and hardworking, we should have the our pregnancy career also at early age.
Thank you so much, ma'am.
Okay.
It was great.
Welcome.
It was great. In one go, we finished it.